SDE can be used as the first approximation for organ doses if we're talking about relatively large organs. Obviously, we're totally out of luck if the organ is not completely contained within the scan volume. I'm never ever going to be able to begin to estimate organ doses of the bone marrow with an SSDE. Important point. SSDE do not, under any circumstance, substitute it for CTDI vol when you use the standard K factors to estimate the effective dose from a CT exam. All those K factors were established and published based upon either the CTDI vol from the 16 centimeter phantom or the 32 centimeter CTDI phantom. And so we cannot substitute SSDE for that. Please also note that SSDE is the dose to the tissue that's irradiated. It's not an effective dose. We're actually talking about dose to the soft tissue. It's not going to resemble at all the dose to bone in the scan volume because, of course, the dose to the bone is going to be elevated relative to the soft tissue. We need to start calculating SSDEs. I've given you some examples of how they're more accurate of estimates of patient dose in CTDI vol. I'd like to see SSDEs as opposed to CTDI vols recorded in the patient's medical record. It's a better representation of the patient dose. DRLs in this country, the ACR for instance, are based on CTDI vol values. They're also based in Europe on CTDI vol values, but they could be based in the future